Hi, everyone. I am Linda Welbrock, the founder and CEO of Leading Women Entrepreneurs and the Force for Change Awards. And our mission is to create a sustainable environment that brings leaders together and showcases their attributes and their contributions for how they're making our state, our country, and our nation a better place. And today, we have a remarkable guest with us today, an honoree for the 2021 Force for Change Awards. Her name is Dr. Amy Spagnolo, and she is in the Psychiatric Rehabilitation Department at Rutgers University and the chairperson for Bridgeway Rehabilitation. I can't wait to tell all of you about the good work that Dr. Spagnolo is doing. Thank you for joining us today, and congratulations.
Thank you so much for having me, Linda. It's quite an honor.
Our pleasure. And after reading your application and seeing the impact that you're making on the state of New Jersey, it's just incredible to have you. So, Dr. Spagnolo, let's start with you telling us a little bit about both of these very dynamic, important roles that you are leading.
Yeah, thanks for the opportunity for me to showcase such important work that's being done at Bridgeway Behavioral Health and Rehabilitation. I'm serving currently as the chair of their board of trustees. And I can say over the past year and a half, in light of the pandemic, the role has expanded beyond what I initially considered. But the work that's being conducted is just so critically important to New Jersey and its residents. In my role as a faculty person in the Department of Psychiatric Rehabilitation and Counseling at Rutgers, I'm primarily responsible for teaching, research, and scholarly products related to mental health services and interventions. I also have a close connection to our graduate students who, throughout the course of the pandemic, were serving as frontline clinicians, providing behavioral health and substance use services. So I've been there for 22 years in the department. And it certainly has been a challenging but incredibly rewarding time to be an educator in our state.
So on that note, what do you think some of the biggest challenges are that you have faced, and some of the proudest moments because you're working in such an impactful industry?
Yeah, so I think in my role as chairperson of the Bridgeway Board of Trustees, I realized very early on in the pandemic that now more than ever, our state and our country need to focus on mental health and substance use disorders. So the pandemic has revealed many things, but one is that those who were already experiencing mental health and substance use conditions got sicker during this pandemic, and those who had never been formally diagnosed with a mental health condition began experiencing very disruptive signs and symptoms of mental health conditions. So both of these groups were, and still in many cases are, living with exacerbated depression, anxiety, trauma. And among those who were already burdened by poor social determinants of health, things like housing instability, unemployment or underemployment, lack of access to quality healthcare before COVID-19, and living in some impoverished circumstances, for them, mental health and wellness became as compromised as their physical health status related to COVID-19. So as a faculty member and a researcher in the Department of Psych Rehab at Rutgers, my own research agenda quickly refocused on the ways in which behavioral healthcare services needed to be delivered by organizations like Bridgeway, because they were required to pivot to telehealth and telemedicine, in many cases with little guidance or access to the technologies that are required to provide such critical services and supports. So what I'm kind of recognizing now, and is clear to many others, is that telehealth and telemedicine are very likely here to stay. And there are real advantages to delivering healthcare digitally or telephonically and virtually. So people who struggled to find adequate behavioral health care, like those in more rural areas of our state or people who are the primary healthcare, primary childcare providers in their family really benefited from the access afforded by virtual services. So in order to ensure that telehealth is available widely and equitably across our state, staff in behavioral healthcare settings still need training and adequate technology, and people who are receiving services need things like internet access and data plans and devices. So we have to continue to ensure, and in some ways strongly advocate, equity in access to technology for all of New Jersey's residents.
Without question, I know keeping everyone safe and having better accessibility has really shined the light on how technology has been a silver lining, especially during this time. I would love to share with our viewers today a little bit about how they can find your services if they personally need it, or if they have a friend who has mental health issues. So where are you located, and how can we get involved?
Yeah, so Bridgeway is located in 11 counties across the state, and our headquarters, which have been there for many, many years, are in Elizabeth, New Jersey. But we are in the midst of relocating our central and administrative offices to Union, New Jersey. We just began a very large building renovation so that we can really have this centralized hub for services as we evolve and move into like the next generation of mental health service delivery, which is greatly expanding both here in New Jersey and locally at Bridgeway. And we employ a no wrong door policy. So people can self-refer by visiting our website and also taking a look at some of the services that are available to individuals who are seeking behavioral health or substance use services and treatment. Family members or friends can certainly check us out as well and get their family member connected to us. We also accept referrals from physicians and local hospitals, other types of treatment centers. So there really is an open access entry at all points for service delivery.
Well, that's really refreshing to hear, because I know just the statistics point to how many problems people have had from being isolated and the fear of COVID. So thank you again for your work. Now, you are being honored as a Force for Change recipient. So how do you see your work continuing to be a force for change in the future?
Well, I think in the role of an educator at this time, we really need to remain committed to the quality of preparation and teaching we're providing to people who will ultimately continue to work on the front lines of healthcare. So a commitment to education and teaching is paramount for faculty at Rutgers, and in my department, I can speak to that firsthand. The other is helping to shepherd Bridgeway into the foreseeable future, which is complicated and is going to require flexibility and adaptability among both the staff as well as the leadership and management of the organization. We need to remain viable in order to continue to provide these services. And in the larger healthcare context, I think that really means being open to affiliations, joint ventures, better collaborations with other community-based organizations so that our reach is wide and our ability to provide these critical services is sustained by a healthy workforce. And so the wellness of staff should be everyone's business because the burnout rates are considerable and the vicarious trauma and negative effects of working in an already difficult segment of healthcare has been compounded by physical safety concerns and other protocols to ensure that our workforce remains well.
Well, I am so inspired by you and all of your team members and the 11 locations that you have in New Jersey. And we can't wait to celebrate and honor all of this on November 8th at our Force for Change recognition ceremony. So until then, congratulations and thank you so much for sharing your your inspirational story with us, and we can't wait to see you on the 8th.
Thank you. It's really been my pleasure, and I'm incredibly grateful.